This quick guide video provides an overview of cVEMP testing. It is supported by 4 further quick guide videos which cover cVEMP testing in more detail. The term cVEMP stands for cervical vestibular evoked myogenic potential. It is an evoked potential measured from the sternocleidomastoid muscle and is used clinically to assess the vestibular system. The cVEMP pathway is well documented, and it is believed that the cVEMP tests the integrity of the saccule as well as the inferior vestibular nerve. The cVEMP can be elicited by either an acoustic, vibratory, or galvanic stimulus. Clinically, the most common method of recording the cVEMP is through using an acoustic stimulus such as a 212 or 222 tone burst at a loud intensity, usually around 95 dB NHL. The response is then recorded using surface electrodes at 4 sites on the head and neck. The most common electrode montage is to record from the clavicular joint, forehead, and each sternocleidomastoid muscle. In order to record a cVEMP, it is important to maintain a contracted sternocleidomastoid muscle. The patient is instructed to turn their head to either the left or the right, depending on which side is stimulated. The patient can then monitor their muscle contraction visually by using a patient EMG monitor or audibly by using an EMG monitor tone. The cVEMP response is well documented and is said to be represented by 2 distinct peaks, P1 occurring at approximately 13 milliseconds and N1 occurring at approximately 23 milliseconds. The latency of these waveforms is of course dependent on the design of the stimulus chosen to elicit the cVEMP. Furthermore, it is recommended to use EMG scaling to ensure even muscle contraction. The amplitude, latency, and threshold can all be measured and interpreted with the cVEMP. However, the most robust parameter to analyze is the amplitude ratio between right and left ears. It has been documented that a difference of 36% is indicative of dysfunction. Through combining the cVEMP with additional tests of vestibular function, clinicians can use the information from this test to assist in the diagnosis of disorders such as superior semicircular canal dehiscence, saccular dysfunction, as well as disorders of the inferior vestibular nerve. This concludes this quick guide video on cVEMP testing.